Bismillah Rahman Rahim. Assalamu alaikum and very good morning. Greetings from Peshawar to the top leadership, faculty, and participants of this grand CPC of Gomal Medical College. It's a highly appreciable step, and I must congratulate all of you for holding such a comprehensive academic activity, and I am really honored to be a part of it. I am recording my lecture in advance in case there is some internet issue, which is a routine over here nowadays, so the scientific program does not get affected. I hope and believe that today's symposium goes well and meets its objectives under the leadership of Professor Naushad Khan, Professor Naseem Sabah, and the whole scientific committee. Let's start today's lecture. Bismillah Rahman Rahim. I am really thankful to Chief Organizer Professor Dr. Naushad Khan and Executive Director Professor Dr. Naseem Sabah, Chief Executive and Dean, Gomal Medical College, for inviting me to the grand CPC on inflammatory bowel disease as a speaker. I must appreciate excellent selection of the topics. I am very impressed that almost every aspect of the inflammatory bowel disease has been covered in the scientific program. Assignment given to me is role of biologics in inflammatory bowel disease. We all know the treatment options of inflammatory bowel disease includes conventional therapies, biological therapies, small molecule therapies, antibiotics, nutritional therapy, surgery, and emerging and adjunctive therapies. We have to select from these options according to the patient's condition, type of disease, stage of disease, and severity of disease. We need to tailor the treatment options according to patient needs. By and large, this is the pyramid of treatment for inflammatory bowel disease. At the base is the antibiotics and 5-aminosalicylic acids. Level 2 is steroids. Level 3 is immunosuppressants. Level 4 is biologics, and then is surgery. And the approaches are either step-up approach, we start from the level 1 and go up, or top-down approach, we start from top level 4 and then go down. This all depends upon the patient's presentation. Assignment given to me is the level 4 treatment option, that is the biologics. What are biologics? Biologics are a class of advanced medications. Proteins are antibodies derived from living organisms, such as cells or tissue, or their molecular components. These drugs are designed to target specific components of the immune system or cellular processes, making them highly effective in treating certain diseases, including autoimmune disorders, cancers, and inflammatory conditions like inflammatory bowel disease. They are typically administered via injection or infusion. What are the characteristics of biologics? They are derived from living systems such as bacteria, yeast, or mammalian cells. They are composed of complex molecules like proteins, antibodies, or nucleic acids, for example, DNA and RNA. They specifically bind to cellular receptors, cytokines, or other molecules involved in disease pathways. And they are typically given via injection or infusion because they are not absorbed orally. Uses of biologics. They are used in a wide range of conditions such as autoimmune diseases, for example, rheumatoid arthritis, psoriasis, inflammatory bowel disease, Crohn or ulcerative colitis, and ankylosing spondylitis. They've been used in cancer treatment as well, the monoclonal antibodies targeting specific tumor markers. In the category of infectious diseases, the vaccines, including novel messenger RNA vaccines. And in genetic diseases, the enzyme replacement therapies. What are the advantages of using biologics in these conditions? Number one is target specificity. They act on specific pathways or molecules, minimizing collateral damage. Second advantage is effective disease control, particularly for conditions unresponsive to conventional therapies. And third is reduced steroid use. Biologic allows for corticosteroid sparing regimes, reducing side effects. What is the role of biologics in inflammatory bowel disease? In fact, biologics have revolutionized the management of inflammatory bowel disease, including ulcerative colitis and Crohn's disease. These therapies target specific molecules in the inflammatory cascade, leading to more effective disease control with fewer systemic side effects compared to traditional treatments. I'll need your attention for a minute on this diagram and to show the four main sites where the biologics get benefit in the treatment of inflammatory bowel disease. The first site is the tumor necrosis factor, TNF, and the agents like infliximab, adalimumab, satralizumab, and golimumab, they block this TNF and control the inflammatory bowel disease. The second site is IL-3 and IL-12. And the molecule here is, of course, ustekinumab. The third site is integrin, natalizumab, vedolizumab, and etrolizumab. And the fourth is the small molecules tofacitinib, the JAK inhibitors. So these are the four main sites where different biologics act upon and result in the therapeutic response in inflammatory bowel disease. So, if I explain it in a slide, we know immune dysregulation plays a key role in pathogenesis of inflammatory bowel disease. The biologic target specific pathways involved in inflammation, and these include tumor necrosis factor alpha, TNF alpha. We know it's a pro inflammatory cytokine and it's elevated in inflammatory bowel disease. And the biologics which act on here is the infliximab, adalimumab, certolizumab, and golimumab. Then the second site is interleukin 12 and 23 pathway. We know it's involved in Th1 and Th17 immune responses. And the biologics which interfere on this pathway, which blocks this pathway, is ustekinumab. Then the third site is integrins. And by acting it, they block migration of inflammatory cells to the gut. And the biologics acting through this mechanism is vedolizumab and natalizumab. And then the Janus kinase or JAK inhibitors, these are the small molecules. Technically, these are not traditional biologics. These are oral agents, but they are the part of the advanced therapies for inflammatory bowel disease. There are many molecules in this group. Tofacitinib, this is the one which has got its proven efficacy in the controlling of inflammatory bowel disease. And most of we gastroenterologists, we are using this because of the convenience of usage as well as because of being cost effective. All these options, the monthly cost is in lakhs. Here the monthly cost is, depending upon the source of the drug, 15 to 25,000 rupees per month. What are the benefits of using biologics in inflammatory bowel disease? It is number one, mucosal healing. It improves long-term outcomes by reducing flares and complications. Second benefit is reduction in steroid use. It allows tapering or elimination of corticosteroids. Improved quality of life in terms of symptom control with reduced hospitalizations. And the fourth benefit is disease modification. Biologics slows progression and complications like stricture and fistulas. So what are the indications for biologics in inflammatory bowel disease then? These are indicated in moderate to severe inflammatory bowel disease, particularly when the disease is moderate to severe, when the conventional treatments 5-aminosalicylic acids, corticosteroids, and immunomodulators fail, when there is corticosteroid dependent or refractory disease, and when there is fistulizing or refractory Crohn's disease, or there is need for rapid mucosal healing in severe disease status. And of course, when there are extraintestinal manifestations in inflammatory bowel disease. How to choose a biologic in inflammatory bowel disease? The selection depends on disease severity and phenotype. For example, fistulizing disease or perianal disease. Of course, prior treatment history is very important in choosing a biologic in inflammatory bowel disease. Risk factors such as infections, malignancy, and immunogenicity. And of course, the patient preference, the route of administration and dosing frequency, and of course, the cost effectiveness. What should be the screening policy before starting biologics? We should screen the patient for tuberculous infections, recent or past, and of course for hepatitis screening. These should be done, and those who are negative, they should be given especially hepatitis B vaccination, hepatitis A vaccination, hepatitis E vaccination, and other vaccinations. What about the safety and side effects of biologics? Infusion reactions like headache, fever, chills, and fatigue can occur during or after infusion of biologics. Rarely, patients can experience allergic reactions such as anaphylaxis. Second risk is increased risk of infections, such as pneumonia and sinusitis, as well as opportunistic infections, including tuberculosis and fungal infections. Autoimmune reactions, such as lupus-like reactions. These may happen with the use of biologics. And of course, malignancy, there is slight increased risk of malignancies, lymphoma in certain patients if they are using biologics. And immunogenicity, the development of antibodies which reduce the efficacy of biologics with the passage of time. When you start a patient on biologic, how to monitor and optimize? Screening prior to initiation of the biologic is important. TB testing, hepatitis B, C screening, and vaccination updates. Clinical assessment is important. Regular clinical assessments are necessary to monitor symptoms, adjust treatment, and address any concerns. Then imaging studies are important. Imaging studies like endoscopic or MRIs may be necessary to monitor disease activity and response to treatment. And of course, regular blood tests like CBC, urea, creat, they are needed to monitor for side effects and adjust dosing as needed. And the drug monitoring, therapeutic drug levels, and anti-drug antibody testing help optimize therapy in these patients. And of course, the maintenance therapy, the continued use is essential for sustained remission. This is very, very important. What are the challenges and limitations with biologics? One is cost. Expensive, these are expensive due to complex production processes. The administration is another challenge. It requires injections or infusion, which may be less convenient to many of the patients. And of course, the side effects, risk of infections like tuberculosis, fungal infections, hypersensitivity reactions, and rarely increased risk of malignancy. The immunogenicity is another challenge, that is the development of anti-drug antibodies which reduce the efficacy. And of course, the cold chain requirement, it must be stored and transported at controlled temperatures. So, what are the future directions for biologics, especially in using the inflammatory bowel disease? One is next generation biologics that target more specific inflammatory pathways. Second becomes the personalized medicine, using of biomarkers to predict response and guide therapy. It may not be effective across the board. There may be patients who respond good. There may be patients who don't respond, or there may be patients who respond suboptimally. So the personalized medicine has got a role here. Then the combination therapy. The biologics with immunomodulators for enhanced efficacy. This may be possible in the future. And of course, biosimilars, cost-effective alternatives to original biologics with similar efficacy and safety. And as I said again, I'll repeat it again, the personalized medicine is probably the need which should be there, the using biomarkers to identify which biologics work best for specific patients. And oral biologics research is underway to develop the true biologics that can be given orally. So, dear colleagues, I conclude biologic replacement is a major advancement in medicine offering precise and effective treatment options for complex diseases. Biologics have transformed the treatment of landscape of inflammatory bowel disease by providing targeted, effective, and sustainable management options. And their targeted approach improves patient outcomes and quality of life, but requires careful monitoring for adverse effects and affordability challenges. Their careful selection, monitoring, and optimization can lead to improved outcomes and enhanced quality of life for patients. So, once again, thanks to the scientific committee and Professor Dr. Naushad Khan for inviting me to this great CPC and to talk on the role of biologics in inflammatory bowel disease. This lecture will be available on my YouTube channel. You can scan this barcode, or you can search the channel The Medicine Made Easy by Professor Javed Iqbal FAROOQI. And this lecture is available on my YouTube channel, and you can see that for the reference. You can also see my other lectures on the medical education. So with this, I once again pay thanks and greetings from our hospital to all of you. Stay blessed and best of luck for the rest of the day. Once again, it's a very, very comprehensive scientific program, and I must congratulate the scientific committee and all of you. Thank you very much.